We have a total of 4. 2 are official and 2 are pending. But I'm comfortable saying and telling you, of the 4 cases, 3 are recovering and fine. The 4th one, I need to confirm their identity so I can get an update on the patient. But that being said, everybody's recovering, everybody's doing well. I do think in Maury County that number is going to go up. There's still a backlog of tests, so I think it could jump again tomorrow and Monday and Tuesday. Until this backlog is cleared, we're going to see this number kind of increase. The number itself will grow more rapidly than it's actually spreading in our community. Now, it's important that, and quite frankly, everybody that's been tested is self-quarantining. So, kudos to Maury Regional, to our medical partners in the community, to the Department of Health. There's great lines of communication. In a crisis like this, no process is going to be perfect, but everybody's doing a great job as far as communicating. People are really getting the fact that let's take this seriously. We shouldn't be panicked. But I've been really impressed the way people are reacting and the kindness and the simple gestures. We get through this together, not because of government. We get through this because we are Americans, and we're going to stick together through this. If you feel sick, stay at home. Don't go to work. Contact your medical provider. If your children are sick, stay at home. Obviously, we already have closed schools. The target date to go back is the 13th of April. I think that might change, but listen, it is a fluid date, and we're looking at that day over day. If someone in your household has tested positive for the coronavirus, keep the entire household at home, in which we're moving that direction anyway, right? Don't go to work, don't go to school. Obviously, contact your medical provider. If you're an older person, and this is a good example. I mean, literally yesterday, we went out, Monica and I, and we did grocery shopping. The shopping was actually for her parents who are older and would be in that more vulnerable category. So we have facilitated them self-quarantining. They're not sick. They haven't been exposed to it, but I don't want them to be exposed to it. So Monica and I spent part of our day yesterday. We went grocery shopping, and then they came to our house. We popped the trunk, and they got their groceries out, and then they went back home. And so there's those kinds of things that you can do for family, but you can also do it for your relatives, people that you know at church who really could use a helping hand. If you're 60, 65 plus, or you know someone that's 60 or 65 plus, go shopping for them. This is real easy to do. It's a simple gesture, and it goes a long way. Because you know what? We're all a little bit scared, but if you're 60 or older, I'm guessing you're probably a little more scared, right? And then obviously if you're a person with a serious underlying health condition, you are in that vulnerable category. And so you need to be taking extra precautions. I'll mention the Wall Street Journal, the New York Times. They've got free resources that you can look at. But I do want to talk about, I received an email from the White House this morning. This came this morning. And obviously there are knuckleheads in the world. And so the Department of Homeland Security is warning people, one, notifying us the details of the travel restrictions between Canada and Mexico and why. That's a good thing. We're slowing the move of people between countries. But then acting secretary, I think it's Chad Wolf, he's addressing this issue that where the government is going to roll out and the army is going to come in and basically take over your house and all this kind of stuff. It's not true. So I'm just going to read what he tweeted. Hearing a lot about texts from friends. This is the rumor, right? Or friends with connections to Department of Homeland Security, and that there's going to be a national lockdown. The acting secretary of Chad Wolf, and acting simply means he hasn't been confirmed by the Senate, so he is the Secretary of Homeland Security. Says, do not believe the disinformation campaigns. Do not pass it along. Use trusted local federal government sources. And to kind of put a point on this, you look at New York, California, and Illinois. I would think Florida might be the next one that comes online. But it's state governments that are restricting the movement of people, not the federal government. And we had multiple weeks to prepare. And so, Maury Regional's done a great job of being ahead of the curve, planning ahead. Obviously, with any healthcare system, if you have a disproportionate number of cases, it could become overwhelmed. But I'm comfortable with where we are. And even if you look at Vanderbilt, there's some pictures out there on social media where they've taken an entire floor of their parking garage, and I think they're bringing online another floor at Vanderbilt, but it's set up, it's enclosed so that they can triage, treat, and so you need to prioritize your patients as far as, I might have been exposed, I'm going to be in this wing because I'm not very ill, versus someone who's very, very ill, and you're only going to want to use that space within the hospital for your critically injured. And so just like you would have to triage on a battlefield, Vanderbilt and all of the healthcare infrastructure in Nashville is preparing for that. And then lastly, be careful if you get any emails promising government money. Do not click that link. Do not answer the phone. The IRS, if you file your taxes, when the government, the Congress, passes the bill that issues checks to individuals, that check's going to come to you automatically because they know who you are, you filed your taxes, and you're going to get it via your return and your social security number. So do not give any information out over the phone, your social, etc., your bank account numbers or anything else like that. And why it's so, to your point, why it's so important that we follow the advice of our president and our governor and your local authorities of, listen, let's self-quarantine or not self-quarantine so much, but if you don't have to go out, don't. Only go out when you need to. If you got to go to the grocery, go to the grocery. If your doctor says, I want to see you, then go to your doctor, of course. But otherwise, let's stay out of these big crowds, etc. Because, if we can we can flatten this curve, we don't have to worry about that scenario that you just mentioned, Delk, and why this is so important. Acts of kindness go a long way. So if it means putting someone else's cart up, if it means just saying hello, or if you notice someone who's having trouble, make sure you reach out to them. We've gotten through these types of crises before. You think about the tension and the fear during the Cuban Missile Crisis. Think about our grandfathers and their grandfather or their dads, during the World War II. When right after Pearl Harbor, and then suddenly you have rationing and the fear of, you go to bed at night wondering when the next attack might occur. Of course, we now know that it didn't happen here in the United States, but they didn't know that then. And so, but we got through those situations because we stuck together. We just did do unto others as you would have them do unto you, and we'll get through this.